Good afternoon, and thank you for joining us for Mental Health at Work, Building Inclusive and Resilient Workplaces. I'm Tiffany Yu, my pronouns are she, her, and I'm going to provide a brief visual description. I'm a Taiwanese American woman in my 30s, and I'm wearing a bright coral colored top, and I'm joining you from my place in Los Angeles. Now, I'm going to give us a couple seconds for people to log in. If you are already here, feel free to put into the chat, introduce yourselves, tell us where you're joining in from, but let's go ahead and give it a couple of seconds. And I see we have, oh, okay, people coming into the chat. Thank you. I see someone coming in from Central California. Thank you so much for engaging in there. I just have a couple of housekeeping notes before we begin today's discussion. This webinar is being recorded and a closed caption version will be shared with you via email in just a couple of days after this webinar. If you want to be able to view the closed captions now, you can select the live transcript button on your toolbar located at the bottom of the Zoom window and press show subtitles. And we also have our ASL interpreters signing. Thank you, Miyako and Amber, for being here. If you happen to have a question, you can select the Q&A button on your toolbar and enter the question and just click send. We have a packed conversation today, so I can't promise that we'll be able to address every comment, but we're going to try to do our best. And at the end of the webinar, we'll be launching a simple survey that we hope you'll take. We know these surveys, you probably get a lot of them, but they're really, really important to provide us feedback to make the programming better and more impactful for you all. And it's super critical in helping NOD shape future programming. So before we begin today's conversation, I just wanted to briefly highlight the organization that's bringing us all together. For more than 40 years, the National Organization on Disability has helped employers create more inclusive workplaces where people with disabilities can thrive. Today, NOD offers a wide range of programs and services to fit your organization's unique needs, from live training workshops, disability-focused event speakers, virtual career fairs, inclusive hiring audits, and more. Someone from the NOD team will put their contact info in the chat box, or you can drop your name there too if you'd like to learn more. And then I just did see a quick comment come into the chat around enabling the transcript feature, so I know that our tech team may be on it. So now let's go ahead and turn to the reason we're all here. Today's conversation takes place during Disability Pride Month and around the anniversary of the ADA. Two important milestones that invite us to celebrate disability culture while also recognizing the ongoing work to build truly inclusive workplaces. Mental health is an essential part of this conversation. I'm someone who lives with a mental health condition, and many mental health conditions are considered disabilities under the ADA, the Americans with Disabilities Act. And depending on how someone identifies and whether their condition substantially impacts a major life activity, they may be protected by the ADA and have the right to reasonable accommodations. Too often, we think about disability and mental health as separate conversations, but they're deeply connected. When we expand our understanding of disability to include mental health, we create workplaces where more people feel seen, supported, and empowered to ask for what they need. And at a time when employees are experiencing increased stress, burnout, and uncertainty, organizations have a responsibility to foster environments that support both well-being and performance. Inclusive workplaces are stronger, healthier, and more resilient workplaces. So together we'll explore practical ways employers can reduce stigma, support mental health as part of disability inclusion, and build cultures rooted in disability pride where everyone has the opportunity to thrive. And I did see a chat come in saying that the transcript has been turned on, so thank you very much. So as we move to the next part, and actually I'm moving a little bit ahead of time, so I was nervous because we want to stay on time, but that means we'll have more time for Q&A. But joining us first, we'll have Rachel Duncan, who is a VP Regional Management Americas at Deutsche Bank. Rachel is responsible for designing, coordinating, and implementing strategic initiatives that strengthen employee engagement, foster an inclusive culture, and advance well-being across the organization. She chairs DB Enable US, advocates for disability mental health and neurodiversity inclusion, and serves as a certified mental health first aid at work volunteer. Rachel, welcome to the webinar.
Thank you very much. I'm very excited to be here.
Do you want to go ahead and just provide a brief visual description?
Yes. I am a mixed race woman. I have dark brown hair. I like to think I'm much younger looking than I really am. I'm wearing a pink shirt and I'm joining you from my home in New Jersey.
Great. And so I have a couple of prepared questions here, but for those who are joining us, feel free to put questions in the chat. And after these kind of like fireside chat conversations, we'll bring our whole group together, and we can continue to deepen the conversation. So my first question for you, since we are celebrating Disability Pride Month, I'd love to talk about identity and community. Now, many people don't immediately think of mental health as part of the disability community, even though many mental health conditions are protected under the ADA. So I want to acknowledge that all of us have mental health. Some of us have mental health conditions, or you may know them as mental health disabilities or mental illnesses. Why do you think that this disconnect between mental health and the disability community exists? And how can embracing disability pride and community help reduce isolation and encourage people to seek support?
Well, I think many people still think of disability through a very narrow lens. And by that, I mean they think of visible disabilities and may not realize that disability also includes many invisible conditions, including mental health. And mental health conditions can significantly affect someone's daily life. There's also a lot of stigma attached to mental health still. While I think we've made tremendous progress over the last decade, I think many people still fear being judged or viewed differently or perceived as less capable if they disclose a mental health challenge. So I think that's a big part of why people often separate mental health from disability in general, because they don't identify with what they believe a person with a disability should look like. If that makes sense. And if it's okay for me to share personally for a minute, I deal with anxiety and severe bouts of depression. And many years ago, I had a suicide attempt, and I don't say that lightly. It took me many years to openly speak about that, but I remember the first time I shared that with someone at work, and I will never forget the look on her face. It was first the I didn't know, which why would you? It was, I didn't know you. I was a teenager. And then I remember she looked at me and she just shook her head and she said, "But you're smart and you're funny and you're pretty." And it hit me that there's just this idea of what someone should look like, depending whether it's mental health or disabilities we talk about. And in my mind, I just kept thinking this has absolutely nothing to do with how I'm feeling or what I was feeling at the time. But it really struck me and it made me realize that, storytelling and sharing my story was so important because so many people, have these misbeliefs about what someone should look like. I also think that we often think about mental health and maybe some more severe diagnoses, where I personally believe a mental health challenge is things that we all face on a daily basis, whether that's everyday life events, a death in the family, a breakup, a move, a new job. They're all very high levels of stress and anxiety for a lot of people. So I just think the more we can talk about it openly and sort of normalize the discussion, the better off it is for everyone. And as far as giving us, I guess I could say Disability Pride Month in general, I think would is a really great opportunity to broaden that understanding. So, if we recognize that disability is just a natural part of the human experience and not something that needs to be hidden or a source of shame, um, then we can really expand that perspective to include mental health and create a space where people can feel seen and more understood. And I think in order to create that space, community really plays a big role. One of the most powerful things I've witnessed through some of the work I've done with DB Enable and mental health advocacy is when people realize that they're not alone. So when a colleague or someone shares, their experience either with anxiety, depression, I work in financial services, so there's burnout, neurodiversity, ADHD, or any other condition, you just feel less isolated. And then you realize, that there's successful people, there's respected people that are navigating similar challenges. Um, so as I said, I really think sharing my own journey um, has had a huge impact on me and how I actually approach mental health advocacy. But I think I also see it and the people I speak to are colleagues. I had one of the most beautiful notes from someone when they saw me speak on a panel and dropped me a note in LinkedIn and said, I'm so proud of myself. I saw you speak. I didn't think I'd ever talk about my mental health challenges. And I saw you do it. And I was nervous. And I finally shared with someone at work. And the person he spoke to really needed the help. And they ended up helping each other. And it was just beautiful to kind of get that acknowledgement. And for me, it's always, if it helps one person sharing my story, then that's all I need. Um, but I think those conversations really just remind people how powerful visibility can be. That simple act of just sharing your story can give someone permission or empower them to actually ask for help or request an accommodation, or support, or just simply talk to someone they trust. It's that creating that sense of belonging and really reducing isolation that can make the difference. And I think that um, something really important about disability pride isn't about defining ourselves by diagnosis, but recognizing our whole selves, including the challenges we face. So I used to think that I had to hide that part of me. Um, I never would tell anyone, especially working on a training floor for me as a woman many years ago, to even talk about a struggle or cry. I'm a crier. Anybody that knows me, I cry. I'm happy. I cry when I'm sad. To cry on a training floor was the worst thing you could possibly do as a woman. Um, I'd hide in the bathroom and it got a little accepted, but it was never to that point. I really think we've come a long way since COVID, but once we can really create those spaces where, we talk about bringing our whole selves, but I really believe in bringing our best selves. And that best self for me is my mental health challenges and my mental well-being and what I deal with every day that makes me who I am. And if I can find that support in the workplace, then I feel connected to others. And that's when I feel empowered and I feel I do my best work.
Yeah, thank you so much for sharing that, Rachel. When we were having our prep call, we realized, so I actually started my own career in financial services as well. I was at Goldman Sachs, and
Yeah.
interestingly enough, their disability employee resource group was my first disability community. And so I think I just wanted to echo some of the things you were saying around how shame and stigma prevent a lot of us who may need mental health support from seeking it out, right? So if we can make those more visible and have, I like to call them possibility models. That's a term that was coined by Laverne Cox. So you're not necessarily they're role models, but
Yeah.
you don't have to follow specifically in someone's role, but having possibility models like you, being more vocal and transparent about the things that you've been through and what you're navigating, I think gives permission for other people who may find similarities or commonalities with you to be able to be more transparent as well, and to be able to bring all those parts with us to the workplace, which is where we may spend a large period of our time. I think a third of our lives was one of the stats that I saw. It may be even more, depending on what
Yeah,
industry you're
I
in.
I would honestly say with what industry you're in, it could be a whole lot more. And to be fair, now that we also have flexible working, I found as much as I love flexible working, there's also this tendency, well, we can start calls a lot earlier in the morning now if you don't need that time to commute. So instead of your what might be an 8 or an 8:30 call, well, I'm a global organization. Well, we can take that call a little earlier. We have 3 time zones to cover, and so sometimes it feels like it's this all day. And it's like by the time you're finally done, it's like, press reset, go to bed and repeat.
Yeah.
So it really is important to have that support because I usually see my coworkers more than I see my family sometimes.
Yeah. And I tell people that we really can't compartmentalize parts of
Yeah.
ourselves. Like I like the metaphor of like a backpack. I think sometimes people think, oh, like our disabilities or our mental health are in our backpack, and when we go
Yeah.
into work, we can leave our backpack at the door, but we can't. It's a part of kind of what we're carrying with us at any point in our lives.
Well,
Uh,
that's like you said, we don't leave our mental health at the door when we come to work. There's
yes,
no way for me to shut that off, even if I wanted to.
yes.
So,
Which leads me to my second question, some of the
sure.
work that you're doing as the chair of DB Enable US. So in your role leading well-being initiatives and serving as the chair of DB Enable US, you've helped shape how your organization approaches employee well-being and inclusion. So from your perspective, why do you think it's so important for organizations to view mental health as an inclusion issue, not just a well-being initiative? And what impact have you seen when they do?
Well, I think mental health is often viewed as well-being because I think a lot of times it's been addressed through benefits or focusing on our EAP or things like that. And you know, those are only part of the solution. That's the focus on the resources part, but it doesn't address culture. So I think when we can think of mental health um, as an inclusion issue, um, because in general it influences, whether people feel they belong, whether they feel free speaking up, whether they feel they can fully participate and contribute in the workplace. And for many individuals, mental health conditions may also be disabilities that actually require support or flexibility or accommodation. So we really kind of need to look at a broader definition than just well-being, especially when it comes to accommodations. And again, I work in a global organization. It's very different depending which country you're in, how that works, and there's a lot more behind it. So the more we can openly talk about it, and kind of think of mental health as through the inclusion lens, then the conversation becomes broader. And it's more than just um, simply helping employees cope. It's actually creating an environment where you can succeed. I think part of that, a critical part of that is psychological safety. That has to be the foundation when it comes to allowing mental health, neurodiversity, disability inclusion to really bring that to reality. Employees need to believe they can ask questions, they can admit mistakes, and you can disclose a challenge without fear of judgment or negative consequences or repercussion. And when you have an environment like that, and you can have those access to the resources, or we have leaders who are willing to ask, how can I support you? What's best for you? Not trying to fix it, but what can I actually do to support you? Um, those are the places you want to work. It sends a powerful message about humanity. And like we said earlier, you can't leave your mental health at the door. So when you're coming into an organization that is going to recognize and support you the way you need, you're going to work better together. You're going to be more innovative. You're going to be more resilient. And I think the resilience component, sometimes I don't love when we talk about resilience because I feel like it becomes this focus on the individual, like my capability to be resilient. But I think if you look at resilience kind of as a cultural outcome, you realize that when we're all being supported, we all work together, we're all coming together, and we're all going to thrive together. So that it's not about me dealing with the pressure of something or being more resilient for my own uncertainty or whatever I'm navigating, but we're doing this together. And now it's a group environment, and it's that community that really brings people along, and you just feel like you're not alone, and you shouldn't actually ever have to choose between your well-being and your success anyway. So if you can do it all together, and we like really do think of mental health as part of disability inclusion, then we really are building a genuine community at the end of the day.
Yeah, thanks so much for sharing that. I think some of the things I want to echo is what you mentioned around the importance of psychological safety.
Mm.
And there is data out there, and hopefully there will be some updated numbers, but about 4 out of 5 disabled employees don't feel that level of psychological safety to be more transparent about disabilities or living with mental health conditions. And so really appreciate you kind of sharing that. And then something we talk about in the broader disability community is how do we move beyond pathology to culture, like beyond the diagnosis to culture? Because when you have culture, you're part of a community. You've removed the shame and stigma from it. There's history, there's pride, community empowerment, and all of those things as well. So I appreciate the initiatives that you're leading there. So I just want to say thank you so much, Rachel. We'll say goodbye to you for now, but you will be back and chat with us a little bit later. And as a reminder to our audience, we have some time saved for a Q&A later, so be sure to get those questions in. Again, I think if you're in this bottom toolbar, there should be a little Q&A. I know there's a lot of activity going on in the chat, so it's best for our team if you submit any of your questions through the Q&A feature. So next, I would like to bring in our second panelist, Adam Nemer. Adam Nemer is an author, former Kaiser Permanente executive. I did see in the chat we have some folks from Kaiser Permanente joining us, and he's the founder of Simple Mental Health. Drawing on his personal experience with depression and anxiety, he helps organizations build mental health literacy and supportive workplace cultures. Today, he partners with leaders across the Americas and Europe to help people and performance thrive together. It's great to have you with us, Adam. Welcome.
Hey, Tiffany, thank you so much. It's great to be here. And if for your visual cue, uh, graying, balding, older white guy in a blue shirt, really just a forehead that as I look at these picture, I really just see a shiny, big I see my dad in this. Oy vey. It's great
Uh,
to be here. And,
well,
and, and
I'm
it, to be here with you
I
and
was like,
Rachel is
how do
special
I
for me.
respond to that? Well, the fun part about this is I believe Rachel and Adam have known each other and been on panels together. So I'm a little bit of the third wheel here, but I'm so grateful I get to moderate. So a couple of questions for you, Adam. The first one: for nearly 2 decades, you were a successful executive while privately struggling with depression and anxiety. Looking back, what were some of the barriers that prevented you from seeking support earlier, and what can organizations learn from that experience?
Yeah. Um, to paint the picture for you, I spent nearly 20 years while I was a CFO and operations leader with Kaiser, while I also experienced severe but undiagnosed depression and anxiety, right? I had no idea. My story's earlier in life when I was 29 and getting groomed to run my family business here in Oregon. I found my dad after he died of suicide. And, I just, the stigma of the disease at the time was so strong that I really didn't get much help. I got an MBA. I went and got an MBA. I got married. I had this lovely career at this wonderful company, but I was going along for 17 years with just evolving greater and greater and greater severe. I couldn't control my emotions. I couldn't control my health. I was one sick puppet. I had no idea. And that, we talk about, you asked, what was the key barrier for me getting help? It's the fact that I didn't know. I just thought that how I felt was what life was supposed to feel like. When I double click on that and I reflect on that, and I'm like, well, so how did that happen, right? It's you and Rachel have talked so much about this already. My barrier to getting help is just like everybody else. Here, what's the stat? Almost 25% of Americans struggle every year with a diagnosable mental illness. Less than half get help. The average time period from the onset set of symptoms to getting help is 11 years. Can you imagine noticing the signs of breast cancer or skin cancer and waiting 11 years to go to the doctor? And, the number one reason when people are asked, what's the list of reasons that you don't get help for your mental health condition? 80% of the people say their number one reason is stigma. And that was me too, right? So listen, I found my dad after he died of suicide. I was running a senior level career feeling like not good, right? I knew, but I didn't know. In the back of my head was this little locked box that said, dude, you're friggin' nuts. Your dad's, and they don't let people be CFOs of $4.5 billion care delivery systems. They don't let people run the operations of a $4 billion health plan if they have what I have. So I put it back in that lockbox, and I didn't. I just didn't know. So it's for me. I think my story is similar to 80% of the people out there. It's not about service availability. One of my favorite stats, I shouldn't say a favorite stat, it's a stat that really highlights this point. More than 53% of Americans every year have an EAP benefit, an employee assistance benefit through their workplace. But like only 5% of them use it. We, yeah, it's hard. There are gaps of coverage, and there are parts of America, and so it's not 100% coverage. But for me, and I think for a lot of folks, it's not about the service availability. It's about the stigma in our society. That was my barrier, and it was busting that barrier that allowed me to get help.
Yeah, and I want to talk about that busting of the barrier. But first, I also just wanted to share that I'm grateful I get to be a part of this conversation because I also believe that July is Minority Mental Health Month, and as someone who is part of the Asian American community, we are one of the communities that are the least likely to seek mental health support. And for me, living with PTSD, it was a 22-year treatment gap, right? You mentioned 11 years between, to get to that diagnosis. So my hope is that me, you, Rachel, and everyone else who is speaking out more about mental health and destigmatizing it will help support more people to get the support that they need. And I love that you said it's not about the lack of availability of the care. Perhaps it's not knowing, or it's the stigma or the shame around it, around what it means to live with a mental health condition. But I want to talk about this busting of the barrier because you have shared that a compassionate colleague played a pivotal role in encouraging you to get help. I was wondering if you feel comfortable to share a little bit more of that story, but also what it teaches us about the power of everyday leadership and peer support in the workplace.
Yeah, so back to the story. Oy vey. Uh, I'm going along for yeah, find dad suicide, going along for 17 years, trying to have this executive career, kids, all this stuff. And I am, after 17 years, hot as can be. And I had this triggering event one day. I was doing a welfare check on my mom, and I found my mom after she passed away. And I had a complete, in the process of finding her, I had a complete emotional breakdown, and I didn't know it. I was running our health plan in the Northwest. I started wearing Levi's to work, t-shirts to work, flip-flops. It looked like I was going to the beach every day, not running a health plan, right? And I was mean as hell to everybody. About 3 weeks later, this national leader shows up my office. National Kaiser leader comes to my office one day on a Monday morning, 3 weeks later, and he's like, "Hey man, how are you doing?" I'm like, "I'm doing great." He's like, "Well, I know about you finding your dad's suicide so long ago, and you just found your mom. Are you seeing a therapist? Is that why you're doing so well?" Like, I don't need to see a therapist. I'm doing great. He's like, "Well, do you know the signs to look for in yourself in case you might need to get some help down the road?" This is a national Kaiser executive, right? As I say no, and we're just at a Monday morning, and it's just shooting the breeze. As I say no, he pulls out of his pocket and slides across the desk the business card for Kaiser's employee assistance program, right? Leader, national leader, executive, national leader of a big company, right? He's like, why don't you give the folk over in EAP a phone call? It can't hurt. You've had these traumatic experiences in your life, and you should at least know the signs to look for in yourself in case you might need to get some help down the road. And that was what got me to go see EAP, which started me on the journey of getting help. And what's the connection to leadership here? This national Kaiser leader who came to see me on Monday The day before on Sunday, he was at his church in a mental health first aid class. He's sitting in his church on a Sunday, and they're going through the signs and symptoms that someone could be struggling with their mental health. And he's like, Nemer, 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 Nemer. Oh my God, Adam's in a lot of trouble. Next part of the class, they teach you how to approach somebody in a safe, thoughtful, caring, non-judgmental manner. Rachel teaches this at Deutsche Bank to people all over. He came up with the idea of giving me the business card to EAP. So when I think about what's this tell us about leadership, right? It's you and Rachel talked about folks not leaving the emotions at the door, right? What the lesson what I learned from all of this it is that when leaders put mental health literacy in their professional toolbox. We have you get how to do a budget, how to do a plan, how to have an HR, we all know CPR. If someone's choking at a lunch meeting, we know how to help them, right? When we mental health, when leaders put mental health literacy in their professional toolboxes, then lives change and performance improves. And it's just another easy to add expected skill for a job. Leadership, in effect, is a job. And like all jobs, you're expected to learn and grow and get better at them over time. And that's the lesson here for leaders is, man, think about if the leaders of all those companies who are giving people EAP actually encouraged its use, like this guy did.
Yeah, wow. Thank you so much for sharing that. And I saw in the chat a lot of people were commenting like that executive sounds amazing, but I actually think it's also a great takeaway. And I think some people also included the mental health first aid training as well. Like that's an actionable takeaway that you can take from this webinar to equip your leaders with. So really appreciate that this part of the conversation, Adam. We've talked about supporting mental health through inclusive workplaces. So we're going to shift toward practical tools people can use right away. So to help us do that, let's go ahead and bring Rachel back in. There we go. And I've got a couple of questions here, and then after my preset questions, then we will turn it over to the Q&A. So the first question here is, in high pressure environments, there can be a perception that supporting mental health and driving performance are competing priorities. How do you respond to that concern, and what have you seen when organizations successfully prioritize both well-being and business outcomes? Rachel, how about we go ahead and turn that over to you first?
Yeah, well, they're absolutely not competing priorities. The reality is they go hand in hand. People perform at their best when they feel supported, valued, and psychologically safe. I know that. When I feel better, I do everything better. And we can get great performance short term if you want to, if it's fueled by stress or fear or burnout, but that's just not sustainable. So it really comes down to, again, how do we balance well-being and performance? And working for a financial services institution, at the end of the day, we're a bank. We're here about our clients, we're here to make money, that's what we're here to do. But in the long term, in order to get to that place and be successful, we have to engage in our people. We have to invest in our people. And in order to do that, this is why we need to invest in well-being at the end of the day, because again, we're going to perform better. In this age of, AI, people are very, very fearful about what's to come next. But when we're in a discussion, in team meetings, if you're in there with fear that I may lose my job, a lot of times everybody goes along with, whatever the majority says. You have to be able to show your dissenting opinion. You have to be able to come in and speak up. And by doing that, we're actually being more innovative. We're being more collaborative. And at the end of the day, we're going to get better results. So again, creating that support, that community, engaging leaders, again, to share stories. I've told several leaders who've asked about, well, how do I fix, or how am I better about this? It's not about fixing someone or fixing the situation. It's about just creating that safe space. And again, not necessarily what can I do as a leader, but what can I do to support you? What do you need to succeed? And it could start as simple as, your weekly meeting. Come in and just ask everybody, how are you doing? How are you feeling? And take time to actually listen. Again, it's not fixing someone, it's not finding the solution, but once people can see or share, be vulnerable, show your humanity, come in with, hey, I had a tough weekend or something happened to me. A lot of times we think, leaders are on this pedestal and, nothing happens to them and this is why they're successful. And like you were saying, Adam, you were running this organization and you had no idea what was going on. So, I mean, you managed to do it and you were clearly successful, or you wouldn't have been able to do it as long as you did. But you have to be able to see who you are in someone else. So I think it's really important that we, realize that we need to be sustainable when we really look at how we approach this.
Yeah,
We pay for it the other end.
Yeah.
I struggled with Crohn's disease. I had 3 surgeries, 11 hospitalizations through that whole period. My lack of taking care of my mental health came out through my remarkably exacerbated Crohn's disease. We all pay
Well,
for it.
that's true. Yeah, I absolutely believe that.
Mhm.
And we always look at, for most people, you would hope they go for an annual physical exam. But why don't we actually take any preventive measures about our mental health? Why do we wait for something catastrophic to necessarily happen before we actually take a step back? I know at least most people that I know when we talk about this, it's like, oh, just I'll deal with it. It's nothing serious. I'll get to it. I'll get to it. But if you had a physical illness or something that happened that wasn't getting better, you'd be in urgent care after a few days, looking for maybe your antibiotic or quick fix. I think part of the reason it's so important that we reduce the stigma is because, again, you said there's not lack of resources now, but there was a time where people had a really hard time finding a therapist. I always kind of compare it to online dating. You could find someone, but once you get in the room with that person, like that first date, if you are not vibing, I had a doctor that used to look at her watch. And one day I lost it. I'm like, am I boring you? And I was like, I got up and I walked out. And then at that point, I was so turned off. It becomes, how do I find the right person? Or people don't want to do it virtually. So now I think we've gotten a lot better at, how do we advertise and how we get people to seek support. And, there's somebody for everyone. But again, I have to be okay to go and get that. And I think
Mhm.
EAP is really important. And I think one thing that we really need to emphasize, though, we have amazing mental health benefits where I am at Deutsche Bank, but people are still fearful that HR will know about it. That as soon as they seek that support, oh, my name's on a list. And I just really emphasize, again, with the mental health first aid team, how important it is to know that this is completely confidential, completely confidential.
Yeah. We spent a lot of time during this conversation talking about stigma. And so, Adam, for you, to touch on this, stigma continues to remain one of the biggest barriers to employees seeking support, in addition to, the dating of the finding what mental health support will be best for you. But what practical steps can leaders, managers, and colleagues take to reduce stigma around both mental health and disability and normalize conversations about accommodations and well-being and help people feel comfortable asking for that support? That was
Yeah,
like there are three questions in there.
I'll I'll blabber on for a moment and you can tell me which one I answered. So, I believe that if you are a leader of people, now I define leadership differently. We're all leaders. I'm talking about the job in a company of leadership, right? In a church, we're all leaders in our communities, in our church, in our homes, amongst our friends, right? So in the hierarchical aspect of work, um, I believe that it's a leader's accountability to share their story and experiences with mental well-being because 100% of us have them because it's a quarter of us every damn year. We've all experienced stress, anxiety. So it's now I go for a living. I mean, I wrote a book about this, right? I wrote a book about myself. I do this for a living. I share my story, and people say, "Well, I'm an accountant in a firm. I'm not a. I don't want to share. I just want to get help." I'm like, it's not your job to share. It's not your job to share. If you want to, you can, because sometimes talking and sharing your story feels good. But if you're going to be a leader of people, just like you know how to do an NPV analysis, need to know how to do a SWOT analysis, need to know how to read financial statements, put in operational projections. You simply need to know the signs that you need to have in your toolbox. This and the knowing how to notice if someone might be struggling, how to approach them thoughtfully and guide them to services, and how to encourage its use by sharing their stories. And it can be as simple as, okay, if you're a leader on this phone call, if you're a manager on this phone call, very simple thing you can do. Call your EAP manager, whoever EAP organization you use, have them come to one of your team meetings, tell them about the services, and you explain how you've used EAP before, or use EAP yourself, and then share with them what the experience was like. Because to Rachel's point earlier, people won't use it if their leaders don't encourage it, and I just think that's the I guess it's an accountability of a leader.
Yeah, thank you so much for sharing that, Adam. I have one more question for our moderated portion, and then we're going to turn it over to the Q&A, so get those questions ready. But I've already heard like a couple of actionable takeaways that I would take away from this conversation. And Adam, what's the name of your book? Let's go ahead and plug that as well.
Simple mental health.
Simple mental health, yes, which I also mentioned in the intro.
Just
But one is, share your experience with EAP. Another is, ask people how they are if you're doing a team meeting. I love what Adam said a little bit earlier about equipping mental health first aid as part of your leadership toolkit, as part of your training. And so as we continue on these like actionable takeaways for those who are attending, if an organization wanted to take one or two meaningful steps in the next 6 months to build a more mentally healthy and disability inclusive workplace, where would you recommend they start? And this is outside of the reading Adam's book. You can do a book club with Adam's book, and the others that I shared.
Pick a mental health first aid class.
Yeah.
Go to mentalhealthfirstaid.org, put in your zip code. You do this right now. While you are listening to this,
Yep.
go to mentalhealthfirstaid.org and put in your zip code and take the class.
Yes, Adam, preach on. Yes.
I mean, it's dude. This dude went to a national leader at Kaiser. I joke. David went to church one day and went to a mental health first aid class, and my life changed. It's not. Life is no more complicated than that's it. Go take mental health first aid class.
And most of them, we do it at Deutsche Bank, but we also have mental health first aid at work. As Adam's saying, there's also mental health first aid, and those are classes that anybody could take. And I just think like we talk about managers and training, people can be trained for this because at least in an organization, most people leave managers, they don't leave the job, they don't leave the organization. They're actually leaving because the people they're working with is what the issue is, not necessarily the job. So it's just about empowering yourself, just educating yourself. Like I said, you don't have to fix it. You don't have to just know where someone can go. I like to tell leaders, I have a well-being cheat sheet that has all the information for how do you reach out to AAP, how to get a mental health first aider, how to, reach the suicide hotline, all of this information on one little piece of paper. And I ask people to keep it in their office somewhere visible. So when someone comes in, they'll see that and think, oh, okay, what's that? This is here. Maybe this is a safe person. And then have it saved on your desktop because everything has a link. Because sometimes going through all the information is a lot. And once you get through reading it and finding the password, it's like, I don't even know what I'm looking at anymore. So I've said, just let someone know you're a safe space. And hey, if I don't know what to do, I know someone who can help you. So it's really just educating yourself on what's available. And in the case of, your church or your community, make that suggestion. Hey, what are we going to do this Sunday after church? I had an idea. Let's have someone host a mental health session. I mean, you can get trained to do that. It's very inexpensive, especially if you're teaching at the community. And at that point, you can teach in your church. You could teach in other groups, your book club, like you said. And it's very just it's I don't want to say basic that it's meaning that it's not important, but I mean it's really simple things that are just easy to absorb and it can really make a difference.
We all took CPR to be babysitters when we were kids, right? But we should all, this is just a core skill set. And you know, the other thing, as you're talking, I'm sitting here looking at you and Tiffany, I didn't realize I didn't put the dot and dot connect that you started in banking. We got two folks in banking, a former CFO, and we're the ones talking about mental health first aid, right? And I think that really highlights that this is not complicated stuff. We are wired as human beings to notice if someone is struggling. And when we're taught in a simple class, hey, what you're noticing, that's what's going on, could be going on here. It's okay to have a little conversation about it. It's so easy.
You might regret not asking. I always say that. And just that
That's
moment,
lovely.
I always misquote her, but one of my favorite quotes is Maya Angelou. And I'm not going to reference it right, but you will forget what people say, you'll forget what people do, but you'll never forget how people make you feel. And there are times where you just see that one person, and I've looked at someone, I've just said, "Hey, is there anything I could do?" It doesn't have to go any further. Yes, no. If not, I'm here for you if you need anything. And you'd be amazed that people have come back and said, "Thank you for that." Just that one moment of thinking somebody cared for that second just really makes a big difference.
Yeah. One other. Oh, Adam, it looked like you wanted to say something.
I have a whole, NAMI. You're talking about very specific places to go right now, today, to help you, your team, and your community. NAMI. The NAMI teams in every location, they have a
And that
support.
stands for a National Alliance for Mental Illness.
That's right.
Yes.
And I think it's NAMI.org. They have the most remarkable support programs available for folks who are caregivers, and they have programs in the work. If you're looking for a place to learn more about this, they will come and teach you more as well. It's another place you can go besides the mentalhealthfirstaid.org.
Yeah, one of my other actionable takeaways from listening to both of you was the importance of having people share their stories around mental health. And I know, Adam, we kind of heard your story about that amazing executive who had gone through that training and checked in with you. And Rachel, you shared parts of your story, but I was wondering if there was a turning point for you that made you decide to want to share, this suicide attempt that you had and be more open about your mental health at work.
Yeah, well, mine
That
started
was an
in.
off-script question. I apologize,
Oh,
but
no,
I
no,
but I
no,
think
no,
it's
no, no.
important that we kind of need either it's other people kind of bringing those stories out of us, or like how do you empower yourself to start to share your own story?
I think for me, mine all started in my high school years. And to be perfectly honest, when you had mentioned July also being Minority Mental Health Month, my mom's white, my father's black, and culturally speaking, my father, you didn't cry, you didn't talk about things outside of the house, and it wasn't that it was unloved, but it was just in his mind, he was also in the military. So if I was crying and I'm a crier, did someone hurt you? Did someone physically hurt you? Because this emotional side wasn't there. And he also grew up very much, I'm the man, I take care of everything and what needs to be done. So no one in my family had ever had any mental health challenges or had issues. Or if they did, it was never spoken about on either side. And when I had mine, I realized after my suicide attempt, the guilt. And then I struggled with that for years. What did I do to my parents? My father couldn't say goodbye to me. He wouldn't leave the room and say goodbye to me. He'd have to come back and say, I meant see you later. And as I kind of worked my way through what am I doing? And then again, being in financial services where forget about bringing it up there. I mean, the expectation was I would be yelled at 45 times a day. And then someone would be like, "Hey, see you later. We going for drinks?" And it was like, Jekyll, Hyde, what's going on? So I never knew what to do with my emotions. And I think it was finally sadly, after 9/11, and I had been working downtown in this separation. And all of a sudden, there was this movement of caring. which sounds almost twisted in its own way, but it became this, you see these things happen just like COVID. There's this time of like all of a sudden compassion and empathy, and we're all one in this community. And when I started to start sharing a little and other people and we're not alone, I saw how powerful that was. And then I just got a little bit more comfortable, telling one person, then another person. Still didn't really share at work. But once I got more involved with the employee resource groups and the work we're doing, I realized, why aren't we doing more? Why aren't we talking to other organizations? They have, Women on Wall Street talk to other people. There's all these groups, and that's how I first got in touch with NAMI and organized with them. And there's so much out there. And it's really interesting. You start to find that when you meet people, like I've met Adam, we all run in the same circles. So at some point, everybody knows everybody, and you just keep putting everybody in contact, and it just grows bigger and bigger, and you see this movement. And by then, it's all I want to talk about. Like Adam talked about babbling. I could babble on about my story all day. It's the one thing I know I can't get wrong because it's my story. So even when I get nerves on these panels, I'm like, well, how bad can I screw up? It's my story. But
Stories
no,
beget
it's
stories.
yeah,
It's like
yeah,
if you'll tell your story. It's like as soon as you tell your story, people will tell you their stories.
yeah,
It's we because it's not like we're wired to want to we're just wired for this stuff.
Yeah. And what I
yeah.
have appreciated about this conversation, I mean, you've got three finance or ex-finance people here. So we've weaved in the stories and the data. We've also provided a lot of data. So depending, and this is how I do my work too. I'm like, if you are the type of person who needs the data, you need to bring it to your managers. Weave that in with the stories as well. So really appreciate the insights from both of you. And so now we're going to open things up. I'm going to turn it over to the Q&A and bring in a few from the audience. I see 17 in the audience, and we only have less than 10 minutes left, so we're not going to get to everything. But our team, the NOD team, was great and highlighted a couple of these. So the first one I want to ask is. Any tips for dealing with, oh wow, sorry, stuff is changing on the document as we move. Let me go ahead and ask the second one. This is for managers who genuinely want to be supportive, but worry about saying the wrong thing. What's your advice for starting conversations about mental health with empathy and confidence? Adam, go ahead.
Take a mental health first aid class. No, I'm dead serious. I'm
Yeah, yeah,
not
yeah.
joking.
Well,
Be-
were there
because
any
when you
scripts?
take the class, it teaches you the words to use. It teaches you to approach somebody in a non-judgmental way by not problem solving, by
Yes.
asking curious questions. By saying you would not say to somebody, dude, go see a therapist, man. But you might say, have you considered seeing a therapist? So in this 3 hours, short
Yeah.
class, less than a day class, they give you those words to use.
And those words are important. If I can share one thing, and I learned this more recently, telling someone, "Oh, it's going to be okay. It's going to be all right," almost invalidates their feelings. And I used to think that I was being helpful, but it's going to be, "Oh, we're going to get through this." And it's like, "No, but you know what? Right now I feel like the world's ending. Don't tell me it's going to be all right because that's not going to help me right now." So, and also the term, "this is a safe space." Well, I don't know your story right now, so it's as safe as I can make it right now, but it might not feel safe for you. And I think, like Adam said, it's more just ask. Just, how's it going? Something seems a little different about you. Is there anything you might want to talk about? Again, it's not problem solving, it's not even digging. It's just starting that little communication to let the person know, hey, I'm open to this and I'm here if you need anything. And most times, once that starts, the person will come to you because they're like, okay, here is someone I can go to.
Yeah. And I know, Rachel, kind of what you mentioned around the like, it's going to be okay, addresses some of the other conversation that was happening in the chat and the Q&A around the toxic positivity, right? Getting those scripts. Uh, and then I want to ask two more questions. We're going to see if we have time. The first is, what recommendations can you give for anyone reluctant to disclose and ask for an accommodation at work?
That's a little tricky. And I say that because it really depends. Again, we are covered under the ADA, but depending on the organization, so let's, for example, if I needed an accommodation, and I hate to always use noise canceling headset for neurodiversity, but it's just the eerie easiest one I can do. Um, Technically, I would go to my manager to say, this is what I need. I don't have to tell you why, but obviously, just by nature, someone's going to say, why do you need this? So I think in that part, again, it's about educating the managers and letting them know that this is out there. Because otherwise, I would end up having to go to the benefits team, go the back end via, is it Aflac or one of these insurance companies, and it would turn into this, you know, bigger deal than I would want to make it. So if we can't have someone that's necessarily educated, you don't feel safe to actually go into your manager, find that mental health first aider or find that person that you could talk to. Because I think sometimes it's about the person's personality too. And find, ways, what's the best way for me to approach this person or how am I going to do this? Because some people are very open, just walk in and say, this is what I need. And that's it, no questions asked. Other people are going to ask you a million details about why and the how and the now. So if you have someone that kind of might know this person or someone that you could trust and kind of look into what it means to get the accommodation, then you'll have that support behind you. Well, I know I need this to get my accommodation, so this is what I need out of this conversation, if that makes sense. I think it really depends on the person, but I think there are people that can help you sort of with that, and you shouldn't feel alone to go in there to that manager and say that.
And this is also where sometimes the employee resource groups can
Yeah,
be a helpful peer support
yeah,
to how to navigate that. But I also love what you said, Rachel, about framing it in a way that's like, hey, this is what I need. Is this something you can provide?
yeah,
Being in HR is okay, right? And so
yeah,
I'm someone who lives with both physical and mental health disabilities. And for my physical disability, I'm like, hey, I need this dish to be cut before it comes out, right? It's not a,
yeah.
and so for me, and again, we're financy type people. I like the pragmatic approach. Yes, there's an
Yeah.
emotional component to kind of asking for that level of support. But as we kind of move into what we need, this is like pragmatically, this is what I need to do my
But
best
you
work.
also didn't ask. You told, which I think is also the approach to go in there with. Like, because sometimes I find I'm a person that has a tendency to say sorry a lot. That's just something that, oh, sorry, I did this. Sorry, I did that. I'm not sorry, but it's just something I've been trained to say, and I try and catch myself. You also didn't walk in there, well, this, and this, and I'd like to have, or could you get for me? You're saying, I need this. I need this to do my job. I'm good at what I do, or whatever the case. And it feels like you have to have this like extra confidence boost, which is why I said sometimes it's good to sort of have that conversation with someone else and see how it sounds or how you come across. Because I'm that person that I respond emotionally to everything. I open an email and I'm annoyed, and I've learned to take the person's name out and write what I really want to say, and then come back, read it a couple minutes later, and say, okay, that's probably not going to go as planned. Rephrase it a little. Sometimes Copilot helps, and then put it in there. But I find myself giving lots of details because that's what I like to know. But sometimes I realize the person I'm dealing with is just a very much tell me what you need, one sentence, and then, get out of my office. We don't need to go into details. So I think sometimes that little practice can help.
Great.
You
And then
know,
we are, oh, go ahead, Adam.
it's
Last comment, and then I have some closing remarks.
on the other hand, it highlights all the critical, important work of the
Yeah.
National Organization of Disabilities and its board members. Because the thing is it's like we got to get more organizations to understand that we're not just talking about, and when we think about employee health and safety programs in our organizations, it's educating them that it's not just physical health and safety, but it's mental well-being too, right? And
That's a
that
great
is
point.
the work. So that employee who asks the question, they're only going to get that. Like we used to get people, they're only going to get that support if that organization now has been educated. And that's the work that the NOD does behind the scenes that makes the world a better place for us all.
Yeah, and I feel like we could have this conversation for a whole nother hour.
Mm-hmm.
But if I can task our attendees and anyone who catches this recording with anything, I would love for you to share any takeaways on LinkedIn from this so that we can continue the conversation around mental health. And something that's been really inspiring in my own work of having been an advocate for the last 17 years is I have friends that I've known for decades who are now sharing about the time they were hospitalized for their mental health or being more open about it. And these are all on LinkedIn because they're seeing so many more role models and possibility models available saying, okay, now I'm ready to share my story. So unfortunately, that is all of the time we have today. I believe there's a closing slide that will come onto the screen. So we'll say thank you again to Rachel and Adam for joining us and for such a thoughtful and honest conversation. The perspectives you shared really highlight the urgency of this moment. And hopefully, it's not just a moment, it turns into a movement and the opportunity we have to get this right. And so, to support that kind of intentionality, the National Organization on Disability, which Adam gave a great plug to, is offering a brand new tool that your organization can put into practice right away. It's called Enable Learning, and it just launched last week. And this is a digital training system designed to help your organization embed disability inclusion into everyday operations. Through self-paced, expert design courses, it equips all employees to improve culture, strengthen performance, and drive innovation. And you can learn more at the Enable Learning office hours, which is on August 14th from 1 to 1:30 p.m. Eastern Time. The link to register will be in the chat. And finally, for those on the East Coast, we invite you to join us for our annual gathering, Technology and the Disability Experience, on October 1st in New York City. So check the chat for a link to get your tickets today. So thank you again for spending part of your day with us and for the work you're doing to help create more equitable workplaces. And I also just wanted to give a plug for the survey that I know a lot of links probably coming into the chat right now, but don't forget to fill out that survey if you really benefited from this conversation. And if you didn't as well, growth area for us. But again, thank you, Rachel and Adam, for your time and for all of you for joining.
Thank you so much.
You guys, thanks.